Residents of Nyeri County, and there have been concerted efforts to register the residents under the program. And our reporter Ibrahim Karanja is now speaking to health officials in the county on the move and why it is important. Karanja, good morning, and thank you so much for talking to us in KTN News Center. Kind of bring us up to date when it comes to this universal healthcare coverage registration process. Has it been?
Well, good morning, Brenda. In slightly over 2 weeks, President Uhuru Kenyatta is expected to officially launch the universal health coverage across the country, and more so in the 4 pilot counties. Those are the counties of Kisumu, Machakos, Isiolo, and Nyeri County. And Nyeri County being one of the pilot counties, registration of households has been ongoing since the 12th of November 2018, and it is expected to end the day after tomorrow. That is on Friday, 30th of November. So, Brenda, there are statistics. There was the target that was intended to be met by the people who are doing the registration process. But so far, by the time of going to press, Brenda, I received this information that so far 99,775 households have been registered. That is 140,000 residents of Nyeri County. That is, of course, from a target of 800,000. So one actually is left to wonder, with 2 days remaining, is it possible to cover the remaining balance? But right now I'm going to speak to medical experts who will give their opinion on the universal health coverage, what they think should be done better, what they think may challenge this whole process, even as we wait for the president to officially launch this program. So joining me right now is Carol Mudhoni, who is a medical actually a clinical officer, and at the same time a nominated member of our county assembly. So she will be giving us a view from 2 perspectives, one as an MC of this great county, and secondly as a clinical officer. Karibu sana Caroline, you're live on KTN News Center. First of all, tell us, will the UHC registration exercise succeed in the remaining 2 days?
I'm optimistic. Thank you very much for giving me this opportunity. I'm optimistic that UHC will actually, we shall go maybe halfway of three-quarter of it before we are done with it. We are saying that everybody should come out for the universal health coverage. This is a privilege we have been given by the president of this country, and we should embrace it, because this whole medical, professionalism and all the medical, free medical, we are being offered by the president. I mean, we are being offered the free medical cover by the president of this country. We should embrace it and actually come out in large numbers.
Probably, if I may ask, the registration process has had lots of challenges. We have seen some residents actually refusing to register deliberately. How do you think, or what do you think should be done better so as to achieve the target by the time given?
Reassurance, that is one, and also media coverage. We need to actually come out in large numbers and tell people, especially the media people, the medical personnel, the governor, you know, and his team. All of us should come out and tell people how important it is in all the wards, that they should come out. Because at the end of the day, if you don't have the card for universal health coverage, then you cannot access the hospital for free. You will have to pay.
As a clinical officer and a member of county assembly in that matter, let me ask, do you think our medical officers, our experts in the medical field, are ready for this universal health coverage and its process and what it all entails?
Yes, they are ready. They are ready. We are here, but we are hoping that we shall have more medical personnel, because in the dispensaries and the health centers, level 2, level 3, level 4, we have to have all the medical personnel who actually will be attending our people in this Nyeri County. Yes.
Probably. Thank you so much. That is Caroline Mudhoni, a nominated member of County Assembly and a clinical officer. And right now, I'll also be speaking to doctors here at the Nyeri Health Center, clinical officers. They'll tell us how prepared are you for this process that will start in less than 2 weeks.
Thank you for the opportunity. We are well prepared, and we're still waiting for people to come and register. We are expecting higher numbers, and I can assure you that we are up to task. Yes.
Well, Brenda, that is one of the clinical officers or medical experts here at the Nyeri Health Center, of course, talking to us about the universal health coverage. And Brenda, as you have heard, the conversation is, of course, ongoing. This is a conversation that will move on for the next 2 weeks as President Uhuru Kenyatta is waited to launch this program. We shall also be continuing with this conversation in this particular show, News Center, Brenda, later in the day. Of course, I'll engage this clinical officer. But as of now, back to you in studio, Brenda.